So, you're a tennis player. How do you stay on the court? And what, if you need spinal surgery, what can you do to stay on the court? Artificial disc replacement maintains motion. It keeps you moving in your spine in full range, which if you're an aggressive tennis player, you're going to need full range for your serve, for your backhands, and even a ripping forehand. So keeping motion of your discs with artificial disc replacement keeps you functional and keeps your motion there so you can get back on the court, reduces back pain and leg pain. Fusion, on the other hand, limits your mobility and stresses your other discs more, which prevents you from being functional and active, especially if you're a good tennis player or an A tennis player and you really want to get out there. So hopefully your spine doctor brings up artificial disc replacements to see if you're a good candidate for it if you like to play tennis.